So, glossopharyngeal and vagus nerve. Let's go. Now, you might be wondering if we aren't going a little bit too fast, covering 2 nerves in one go. But the same as it was the case with the oculomotor abducens and trochlea nerve, where we covered 3 nerves in one go, all related to eye movement, the glossopharyngeal and the vagus nerve are actually very closely related, both physically. They travel along some of the same bodily channels, and they are also very closely related in their function and how they affect our body, our senses, and motor information. So, well, I thought we'll take them one by one, even so, starting with the glossopharyngeal nerve. The glossopharyngeal nerve emerges from the medulla oblongata in the brainstem, then travels down to the jugular foramen, but before exiting the skull, it has 2 sensory ganglia, or collections of sensory neurons, the superior glossopharyngeal ganglion and the inferior glossopharyngeal ganglion. Now, then, after exiting the skull, it branches out to innervate its target areas, these being the pharyngeal muscles, namely the stylopharyngeus muscle, which helps elevate the pharynx during swallowing and is also involved in regulating our speech. Another target area is the posterior third of the tongue, which it supplies sensory information to and from. So the very back of the tongue is actually controlled or maintained by the glossopharyngeal nerve. And finally, it also supplies parasympathetic fibers to the parotid gland, which is one of our salivatory glands, so involved in saliva production. Now, you might remember us talking about the parasympathetic system earlier, and we will get back to that because the glossopharyngeal nerve is involved in that, but more especially the vagus nerve. Now let's touch on the vagus nerve. Similarly to the glossopharyngeal nerve, it emerges the same place. The brainstem travels down the same pathways through the jugular foramen at the base of the skull, then all the way down to the throat, thorax, and abdomen to innervate many, many different organs of the body. Now, the vagus nerve, traveling all that long way, is actually the longest and most extensive of our cranial nerves. It also has the nickname the wandering nerve, vagus being Latin for wander. Some of the organs that are touched by the vagus nerve include the esophagus, intestines, stomach, heart, lungs, liver, pancreas, and many more. So it is extensively involved with the parasympathetic nervous system, helping the body relax, slowing down heart rate, helping the digestive process, also the inflammatory response is helped by the vagus nerve, bowel movements even. So many different and important areas are maintained by the vagus nerve. The vagus nerve, like the glossopharyngeal nerve, also supplies motor information to the pharynx and larynx, so it helps with swallowing and speech. And it also has a sensory component. Interestingly enough, from the internal organs, actually, it has has information from the baroreceptors and chemoreceptors in the aorta, helping to sense oxygen levels and blood pressure. So some interesting senses, not the same kind of sensory information as eyesight or hearing or outside touch and pain receptors, though there's also some of those, namely around the outer ear and as well as the eardrum. So even though the skin is one organ and there are pain and touch receptors all over our skin, all over our body, different parts of the skin and the body is controlled by different cranial nerves, and the vagus nerve, funnily enough, it has sensory information from the outer ear and eardrum, like I said. So, having been through all of that, I'd like to ask you some questions and about possible symptoms that may indicate damage to either the glossopharyngeal or the vagus nerve. So, let's start with taste. Have you been experiencing any difficulty or any changes with your sense of taste? Specifically at the back of the tongue, but any changes at all that you noticed? No. Good. Any pain or tenderness in the tongue at all? Okay. So have you in general experienced any decreased sensitivity, either at the back of the tongue, the palate, uvula, or generally just inside of the mouth? Okay. Any dryness, dry mouth? Okay. Any irregularities in your gag reflex that you've noticed? Okay. Have you had trouble swallowing or any pain while swallowing? Okay. And have you been coughing after eating or drinking? No? That's good. Have you had any heart rate issues? Like irregular heart rate where you wouldn't normally have experienced such a high or low heart rate? Okay, any gastrointestinal problems like ulcers, heartburn, indigestion, irritable bowel movements, anything like that? Okay, well, that all sounds good. So let me just get rid of these and just look inside of your mouth. Okay, so I have my light once again. Can you just open your mouth for me? Okay. That's good. Okay, now can you open wide and say, ah? Open wide. That's good. You can stop now. That's great. Thank you. So, it's just assessing the soft palate, the uvula, looking to see that everything was symmetrical and raising equally when you enunciated, which it did. So your mouth on the outside looks fine, and there are just a few more tests that I'd like to do just to be as thorough as possible. Now, this next test might be just a tiny bit uncomfortable, okay? I'm gonna try and activate your gag reflex. Yes, it'll only be a moment, so if you can open wide. I'm gonna insert the tongue depressor in your mouth and just you. There we go. Okay, I'm sorry. Now, but that is it. We're done with that. Okay, so can I just get you to cough for me? Sounded good. Strong, explosive cough. Okay, I'm gonna touch your neck. Is that okay? Okay. Now, cough again for me. Good. Just your chest here. Cough again. Good. No, that's fine. Now, have a glass of water, or just one single sip will actually also be fine. But keep it in your mouth. There. Good. And swallow, please. Was that alright? That feel regular? Good. Okay, I want to continue with a voice quality test, and I know we've been having a nice conversation, so it really might not be all that necessary, but still I'd like to stick to the test as written and be, like I said, as thorough as possible. You never know what could come up. So, just locate just here. Okay. So, I have a couple of sentences that I would just like you to repeat after me. Okay? So, here's the first one. Imagine an imaginary menagerie manager managing an imaginary menagerie. Very good. Okay, next one. A skunk sat on the stump and thunk, the stump stunk. But the stump thunk, the skunk stunk. Very good. Now, number 3. Betty Butter bought some butter, but she said, this butter's bitter. If I put it in my batter, it will make my batter bitter. But a bit of better butter will make my batter better. Butter bitter. Yes. That's right. Okay, so enough with the tongue twisters. The next one is a dictionary definition. It's quite a long one, so I'll just take it one sentence at a time and you repeat when I signal, okay? So the definition is for the word heart, very relevant to the vagus nerve. Noun, an automatic muscular blood pump. Figuratively, this useful organ is said to be the seat of emotions and sentiments. A very pretty fancy which, however, is nothing but a survival of a once universal belief. Good. It is now known that the sentiments and emotions reside in the stomach. Also relevant to the vagus nerve. Stomach. That's right. Being evolved from food by chemical action of the gastric fluid. Good. The exact process by which a beefsteak becomes a feeling, tender or not, according to the age of the animal from which it was cut. The successive stages of elaboration through which a caviar sandwich is transmuted to a quaint fancy and reappears as a pungent epigram. The marvelous functional methods of converting a hard-boiled egg into religious contrition. Or a cream puff into a sigh of sensibility. These things have been patiently ascertained by M. Pasteur, and by him expounded with great lucidity. Very good. No, you're right. It wasn't a normal dictionary. You got me. It's actually from the Devil's Dictionary. Now, the last test that I want to do for the glossopharyngeal and vagus nerve is a taste test. Now, you might say we already had a taste test, didn't we, when testing the facial nerve? And you're right, but that test was only for the tip of the tongue, or the anterior 2/3 of the tongue. Now we are testing the posterior third of the tongue, so the very back of the tongue. But the test will be conducted in much the same manner as before. I'll take a dropper and just place a few drops of tasteful liquid at the very back of your tongue, and you will evaluate whether it is sour, bitter, sweet, salty, or umami, and also how intense the taste is. Okay? Good. Let's get going. So, now, same as before, we have the different tastes here. If you could just look at me, and I will start. There we go. Now, stick out your tongue as far as it will go. Okay. What taste would you describe that as? Bitter. Okay. Mark that as bitter. Moderately intense. Okay. Next one. Okay. Stick out your tongue as far as it'll go, and this will be at the back. Okay. And how would you describe that taste? Salty. Very salty. Okay. Okay. Another one. Sweet. Okay. Slightly sweet. Okay, take out your tongue. Salty again. Okay. And moderate again. That's fine. This one here. Okay, stick out your tongue. There. Umami. Okay. Very intense. Good. Next one. There we go. Nothing. Just no intensity and no flavor. Okay. Okay. Just a couple more. There we go. Stick out your tongue. And let's go all the way to the back of the tongue. There we go. Okay, what was that? Bitter. Slightly intense. Okay. This one. There we go. Stick out your tongue. Good. Sour. Okay. Moderate. Okay, final one. Stick out your tongue. There we go. How would you rate that? No flavor. You're right, that was just water. Was it very intense water taste for you or moderately? Just kidding. Though I shouldn't, you know. So, that was all of the tests that I wanted to do in relation to the glossopharyngeal and the vagus nerve, though I did here at the end want to discuss a few tips and tricks and techniques that you can do at home to actually help stimulate the vagus nerve. I talked about it being, you know, the center of the rest and digest, the parasympathetic nervous system, the relaxation of the body and all that. But actually by stimulating, some believe that you can help to relax the body by different means. One of these is a very common, it's deep breathing, but after hearing about the vagus nerve you may have a better understanding of why and how this is supposed to work. Deep breaths in through your nose, all the way down into the lungs and the stomach. Deep breaths in through the nose, all the way down into the lungs and into the stomach, really filling them up with air, all the areas that are innervated by the vagus nerve, and then slowly breathing out through the mouth. Again, the mouth being innervated by the vagus nerve, responsible for relaxing the body. So that's why deep breaths, really filling the body with relaxing air, blowing it out ever so slowly, might actually be able to relax the body in a factual way. Another way you can stimulate the vagus nerve is by touching some of the areas where the nerve supplies sensory information, like the ears. You remember me saying they supply sensory information to the outer ear as well as the eardrum. So if you need to relax your body yourself, you might find it useful to just rub gently along the edge of the outer ear. Very gently and slowly. No pressure is needed here. You're just stimulating the nerve very softly. You may also try to rub the skin at the back of the ear, either in circles or up and down. Just pull the skin up and down, up and down, just very, very slowly. Though medically proven, and there's still a lot of work on the science and experiment front to be done. These techniques have shown some positive signs of actually working, and I've heard good stories and had good experience with them from patients. So I'm not afraid to recommend them to you if you sometimes feel that you could use a bit of extra relaxation in your life. And let's be honest, in this world, who couldn't? But yeah, like I said, that concludes the test of your glossopharyngeal and vagus nerve, and everything across the board, tip-top shape. So, with that, I will let you go and wish you happy, healthy, and most of all, relaxed evening. So, as always, take care of yourself.